So at this point, Grandpa Joe's kidneys are starting to fail from the infection. His blood pressure is dropping. And they say, hey, we need to, change up your antibiotics. You need to go to the surgery to get all of that removed and fix your feeding tube. And we need to put you on dialysis because your kidneys aren't working. So now Grandpa Joe has the trach. He's got the feeding tube. He just had an open abdominal surgery. He's on dialysis for his kidneys. His lungs aren't doing very well because he had that really bad pneumonia from aspirating when his neurostatus declined. So Grandpa Joe went from being at home gardening with his wife to now he's not doing very well at all. His neurostatus is poor. Every organ is not doing very well. And we're basically supporting every organ to a certain extent. And this is a really hard concept for some people to understand, how someone can go from point A to point B over just like this couple days or couple weeks span. And what I usually tell people, we kind of walk through the steps, is that, patients come into the hospital, they usually already have this history, right? He had the cardiac stents, he had high blood pressure, diabetes, he was on blood thinners, and he was doing well managing that at home and functioning with that. But it only took one thing to kind of tip his body over from compensating with all of these medical issues to now everything is working against him. This one insult, this one extra thing kind of tipped him over the edge, tipped his body over the edge to where now everything is competing and struggling and trying to heal, but in reality that everything's just kind of failing all at once. And it's a very hard concept for people to understand, which I totally get, and I empathize and I sympathize for people, because it's hard to see your loved one go from walking and taking care of themselves to now like they can't do anything for themselves, and you're having to talk about like, what do they want for their quality of life? Do we want to continue on, send them to a long-term care facility, rehab, knowing that they probably aren't ever going to get back to where they were before? Or do we want to just stop everything and let them pass away because they would not want to go to like a nursing home for the rest of their lives? So it's hard, it's tough. And with COVID, this conversation has like just exponentially increased. I have it almost every shift because it's really hard for people to understand this. And I get it. I totally get it. So hopefully this can kind of give you guys a little insight, kind of walk you through just one example of how people can go from point A to point B. It sucks. It's hard. It doesn't make it any easier, but I hope at least having the knowledge and the education can help you kind of wrap your brain around it just a little bit more, because there's power in knowledge. And yeah, thanks guys. Hope you enjoyed.